Imagine a world where rare diseases are no longer rare in research attention, where breakthroughs for the uncommon become the norm. That's precisely the mission driving a monumental $15 million NIH grant awarded to Baylor College of Medicine, split between two groundbreaking initiatives tackling some of the most perplexing genetic disorders. But here's where it gets controversial. While the funding is historic, the real challenge lies in translating lab discoveries into tangible, life-changing therapies. Let's dive into the details, and why this matters for patients, researchers, and even skeptics who wonder if such studies justify their cost. Brittle Bone Disorders Consortium, BBDC, a decade of fractured promises now rebuilt. Osteogenesis imperfecta, OI, often called brittle bone disease, is a genetic condition that turns even the gentlest fall into a fracture risk. For decades, patients and families have lived with uncertainty, but the BBDC, now receiving $7.4 million for a final 5-year push, is rewriting that narrative. Led by Baylor and Texas Children's Hospital, this consortium has grown into a global powerhouse, recruiting over 1,000 participants for its landmark longitudinal study. A feat that has already yielded nearly 50 published papers and paved the way for industry-sponsored trials. And this is the part most people miss. The BBDC isn't just about bones. Their work spans dental health, pain management, and even the psychological toll of living with a chronic condition. Dr. Brendan Lee, the visionary behind the project, calls this a blueprint for collaborative research, crediting the Osteogenesis Imperfecta Foundation, OIF, for bridging the gap between science and patient needs. What's next? The BBDC's final phase will focus on 3 pillars, completing a 6-year follow-up with whole genome sequencing, launching a randomized trial for a biopsychological pain intervention, a first-of-its-kind approach, and using high-resolution CT scans to track disease progression in real time. But here's the twist. These aren't just academic exercises. They're about giving patients tools to live better, not just longer. As OIF CEO Tracy Hart puts it, this isn't just research, it's a lifeline. Rare Organic Acidemias Research ROAR Consortium, fighting silent metabolic wars. Now picture a child whose body can't properly process proteins. A metabolic puzzle so rare that most doctors have never seen a case. That's the reality for patients with organic acidemias, a group of disorders where faulty metabolism leads to toxic buildups. Enter the ROAR Consortium, funded with $8.2 million to unravel these mysteries. Baylor and Texas Children's Hospital will lead efforts across 5 sites, including a clinical trial for cobalamin C disease, a vitamin B12 metabolism disorder, and a novel study comparing virtual versus in-person care. Dr. Lindsay Burridge, a co-leader, emphasizes that collaboration is key. We're not just treating symptoms, we're redefining standards of care. But here's where opinions might clash. Should these rare conditions receive the same research urgency as more common diseases? Advocacy groups, like the Organic Acidemias Association, OAA, argue yes. Their involvement in ROAR ensures patient voices shape every step, from trial design to education campaigns. As Kathy Stagney of OAA says, this isn't charity, it's a strategic investment in the future. The bigger picture: funding, frustrations, and what comes next. Both initiatives are backed by NIH institutes and translational science centers, but the real question remains: will these studies deliver therapies within the 5-year window? Dr. Reed Sutton of the ROAR team acknowledges the stakes. We're racing against time for families who've waited too long. Meanwhile, critics might ask, is this enough? Or does the system still favor blockbuster diseases? We want to hear your thoughts. Do you think rare disease research gets the attention it deserves, or are we still playing catch-up? Share your perspective in the comments below. In the end, these grants are more than numbers. They're a promise to patients who've been overlooked for too long. And as Dr. Lee reminds us, every breakthrough starts with a single question. Let's keep asking them. Follow the journey at From the Labs for updates on these and other pioneering efforts.